Yeah, I have a lot of questions for you that I think are going to be helpful for people listening to learn a little bit more about what ARPwave is and how it can be beneficial. You said accelerated recovery performance.
Yeah.
I was almost there. But the key thing about ARPwave is it allows you to really control the nervous system via an outside unit, a machine that helps you reconnect the waves from your brain into all your nerves throughout your leg or whatever you're rehabbing at the time. What makes ARPwave special?
Yeah. No, I mean, so it's a good question. It's a good intro. So really what makes ARPwave is it's a new type of therapy. You know, a lot of times when we get into this conversation in this context, people are always like, what's the machine? You know, we send out the equipment, we work with people through the therapy, they come in, we hook them up to the machine. The machine is really just a tool that we use within that therapy process. So ARPwave was designed and really founded on the premise of working with the nervous system to create a change within the body. So a lot of times we break this down into like, simple conversation points. So the first step of ARPwave, looking at like neuro efficiency is we break it down and say, think of flipping a light switch and the light bulb turns on. All right. So if we go in and we fray the cord and we flip the light switch, well, now the light bulb turns on, but it flickers. So our body and our nervous system really works the same way. When we get into the context of that conversation, when you sustain trauma or sustain an injury, you're getting cellular damage within the body, which kind of shorts that signal out. So now you don't have the muscles absorbing force the way that they need to be absorbing force, and you have force going into other tissue that it's not supposed to be going into. A lot of times, like ACL trauma, joint trauma, meniscus tears, you might be dealing with like so much force going into an area that the body just couldn't absorb it. But many times it really is just that inefficiency. And the big thing on the back end of recovery, if you have a torn ACL, you go in and you get the surgery, you're really addressing with where the force ended up. You're not addressing the why, like why did the force end up in there? And when you get into that, that's why you see a lot of people that have that re-injury. I mean, I think what the number is, it's kind of like 20 to 30% of people have a re-aggravation or re-tear of that ACL going back into activities. And that's one of those questions where we ask, like, why? Why does that happen? It really does tandem back into that first step. Was there compensation? Was the efficiency happening within the nervous system? Did the muscles turn on? Was the force just too great? So step one is really determining, is the wiring there? Is the connection happening? Is the muscle turning on? Is the muscle absorbing force? And if that's not happening, we got to get that reset done before we move into step two. Step two is kind of the part that you're talking about, where we have a device. We send that out. We're able to go through a diagnostic process. And people always ask, what does that look like? What does that mean? The device itself, it has electrodes. We have a proprietary waveform for ARPwave. It's called the double exponential waveform. And what that means is we can get a high intensity signal, but we also have a second waveform that allows somebody to move while we're doing that therapy. And that is a huge, huge component of this, because regardless of you going and get the ACL repaired, the meniscus repaired, you have no pain, but you go back into activity and you still have compensation patterns. Again, you have force going into areas it shouldn't be going into. So that the movement pattern of the therapy of breaking old patterns and creating new patterns is the big key to this. And kind of the thought behind ARPwave, when you talk about ARPwave, like the greater the intensity, the greater the change. So as we get into that therapy, there is a portion of that where we are working at a higher output power or a max tolerance for that client, where they're bringing it to that high output power. We're getting the muscle contracting, and we're putting about 500 pulses per second into that tissue. So a 15-minute treatment is equivalent to about a 3-hour workout. And with that high stress and that proper movement, we now start to break down those patterns. Third component of the treatment is happening while it's going on too, is we're building strength. And while we're doing that to prevent the injury from happening again. But as you kind of alluded to, when you're getting into the ACL Club, and what I really liked about that is like, there is a whole mental component that comes with this injury too. I mean, especially getting back into being active and running and jumping. There's force absorption testing that we get into as well. And I know you did a great job, Jordan, of documenting a lot of that stuff through your videos that you had posted, but getting out there and actually like showing people that they can do that activity again without having to think about what are my consequences of going out there and running and jumping and doing what I want to do. It really is all about, though, like that 3-step process. And if you take that recipe and you take a step out of that process, it's much like making chocolate chip cookies, but not putting the chocolate chips in there, right? I mean, it is a step-by-step process. And when you follow it, many times it's predictable.
Yeah.
And we've seen it over and over. I mean, we've treated, close to thousands of ACL patients and even like tens of thousands of knee patients.